The invention of antibiotics marked a revolution in clinical medicine and public health, paving the way for unprecedented advances. This discovery made surgical procedures safer and was fundamental in reducing infant and maternal mortality. The origin of many antibiotics is in natural organisms, such as bacteria and fungi. For example, penicillin, secreted by penicillium, is effective in combating bacteria due to its antimicrobial nature, a resource used by microorganisms to protect themselves from external threats. In recent years, however, the use of antibiotics and antimicrobials, which encompass agents against bacteria, viruses, and fungi, has increased exponentially. This growth is attributed both to excessive prescription in humans and to its systematic use in farm animals. Notably, a considerable portion of these medications is excreted unchanged by humans and animals, contaminating sewage systems and continuously exposing pathogens to these agents. As a result, we are facing a significant increase in microorganisms' resistance to antimicrobials. Bacteria, in particular, have developed four main strategies to resist antibiotics. The first is the inactivation or modification of the antibiotic, a process in which specific bacterial enzymes, such as beta-lactamase, neutralize the action of the medications. This makes bacteria that produce these enzymes resistant to a wide range of antibiotics. The second strategy is the alteration of the antibiotic's binding site, rendering it ineffective. A notorious example is MRSA, which alters its binding points to penicillin, thus escaping its action. The third approach involves the modification of metabolism to bypass the effect of the antibiotic, as in the case of bacteria that, in response to the action of sulfonamides, acquire folic acid from the environment, neutralizing the impact of these medications. Finally, the fourth strategy consists of reducing the accumulation of the antibiotic within the cell, either by decreasing the permeability of the membrane or by actively expelling the medication through efflux pumps. These resistance mechanisms vary among different microorganisms and represent a continuous challenge in the development of new antibiotics. Antibiotic resistance necessitates innovative and effective solutions to combat this growing threat to global public health. It is crucial to recognize that the problem of antibiotic resistance transcends medical science, representing both a social and economic challenge. The improper use of these medications, both in humans and in agriculture, accelerates this problem. Therefore, it is imperative to promote education on the responsible use of antibiotics and develop public policies that encourage sustainable practices. Moreover, investing in research and development of new antibacterial agents and therapeutic alternatives, such as phage therapy, is vital. However, these initiatives require international cooperation, appropriate funding, and a multidisciplinary approach involving scientists, health professionals, politicians, and society. Our fight against antibiotic resistance demands joint action. This includes the conscientious use of medications, support for scientific innovation, and the implementation of robust public health policies. By joining forces, we can ensure the efficacy of antibiotics for future generations, keeping them as essential tools in the fight against infections.